Struggling from an imperfect smile and looking to renew your confidence again? Dr. Andrea Joy Smith may be able to help. Melissa Paul got all the details.
My passion for mini dental implants really comes from my desire to solve difficult dental problems that my patients faced over the years. 11 years ago, for instance, before I offered this service, my patients would come in with several types of dentures, several sets of dentures that did not fit very well. They had heard about implants, but they were often told that they didn't have enough bone to receive them, or with the expensive cost, they didn't have enough money to receive them. And so mini dental implants is that solution to both of those problems because they don't require as much bone and they do cost a lot less.
Okay, and so for those who are not familiar though, to explain a little further, what exactly are mini dental implants?
A mini dental implant is a small medical device. Kind of picture it something like a screw. And it is used to be inserted into the bone to either hold a tooth on top or to secure loose dentures. And they're made out of titanium because it was found that titanium actually fuses to bone. And so they've been used very widespread since the 1970s.
And tell me, how is your experience or how is your office with putting in mini dental implants different than going to a different office?
Right. Well, mini dental implants are not as available in Sacramento as your conventional implants are, and that's fine. Patients everywhere are receiving traditional size implants. But in my office, what sets it apart is that I offer the smaller diameter implant for those patients who don't have a lot of bone. Maybe the cost is an issue for them, and it just allows them to receive a service that they really can't get in many other places.
Yeah, and so obviously, I mean, the benefits of getting many dental implants is actually pretty broad.
Yes,
Yeah.
yeah, they are less costly, they're less invasive, there's less surgery, there's less healing time, and most patients love the fact that there's a lot less pain associated with receiving them. And he has a big mustache, so he didn't really worry about his teeth so much until he noticed that people were really looking right in his face as he was speaking. And so he came in after being very embarrassed about his smile, wanting to find a solution, and we were able to remove the remaining teeth that were not restorable, and we were able to do a full mouth reconstruction
That is the same
of his mouth.
That is
That is the exact
incredible.
same person, yes.
And then we also have some photos of a woman who went through this process.
Exactly. She believed that she was going to have to eat baby food for the rest of her life. She had a lot of dental anxiety. Every time she went to the dentist, she was either getting a tooth pulled or having some infection treated. A friend of hers who had come to my office and received mini dental implants told her about me, and when she came in, she didn't know if she could be helped. She thought her situation was far
She
too
felt
gone,
helpless.
and she was very helpless. And it turns out we were able to do a full mouth reconstruction with her as well, giving her teeth that she
Wow.
can smile with, eat with, and be very confident about.
Yeah, okay.
Yeah.
And then I know we also have some video that will help further explain the process of getting many dental implants. Shall we take a look at this as well?
Yes, this is a
Okay.
great case where a patient was missing just a few teeth on one side, and there the picture shows that the implants were in place, and now the crowns, the two teeth that were fabricated just to go on top of those implants to complete the rest of his teeth. But my biggest beneficiaries of mini dental implants are those patients who have been wearing dentures for years, and they've had to buy multiple denture adhesives. They have to put them in probably 2 or 3 times a day, and now these dentures can be snapped right into place.
So, Dr. Smith, if people are watching and they're curious and they're wondering if this is the right step for them, what do they do?
The next step is to call my office. My number is 916-482-8300. My staff is there, and they will take phone calls for you and set up a consultation. And of course, you can find me on the internet, on Instagram and Twitter at Dr. Andrea Smith. And my Facebook page is Dr. Andrea Joy Smith Family Dentistry, and I'll be happy to help you.
This interview involves commercial content. The products and services featured appear as paid advertising.